So the points you were discussing, or you mentioning that by history taking, which is important. Now, with the history taking, I think all of us have done it in the medical school or while taking an examination thoroughly. But few things I like to just highlight, that if you are very methodical in taking history, you will come to a diagnosis definitely in this headache situation. So when you are taking about the onset history, there are two things you have to onset: that at what age it has started and whether it is sudden or gradual. We have mentioned about the sudden onset headache at the age of more than 50. Location, you know that whether it is unilateral, it is bilateral. So unilateral headache, typical of this cluster headache. Bilateral band-like tension headache. Unilateral spreading to bilateral is migraine. So in particular, any sites, it's in the back of the head, in the occipital area, maybe malignant hypertension or some cervicogenic headache. In the face area, sinusitis or frontal sinusitis can give headache as well. Severity, that how fast the headache is happening in this intensity. And always it is better to ask them to scale the pain in the grade of 1 to 10, if 1 is not minimal and 10 is maximum. And how does it affect the daily functioning? Now, when it comes to, say, migraine, we easily say, okay, it's a very common condition, you can try this tablets, but it's important that what is the function or what is the job of that person, how that is affecting. Even if it is a housewife and say they have to go to the drop the children in a sunlight, you have to tell them something about that you have to protect yourself. Otherwise, anytime you are exposing yourself to sunlight, then it can get worse. How frequently it is happening, or how many days in a month you are pain-free. This will help you to distinguish between an acute and chronic headache, and type of headache, whether it's pulsatile, whether it is excruciating pain, whether it's a nagging pain. So these are all description to find out whether it is a mild type or moderate type or severe type of headache.